Please may I introduce Dr. Tula Belfour, who's our Head of Health, and Tabelo Chipana, our Senior Executive of Public Affairs and Transformation. The briefing today is about the COVID vaccinations and the way the industry has combated the pandemic. And if I may hand over to Dr. Tula Belfour.
Thank you very much, Alan, and good afternoon, everyone. I'm going to give the overview of exactly what we're doing, and Tabelo will take all the questions. I think first of all, one would like to say that we need to recognize that we've just been through a very unique period, where we had a pandemic. And the last time we had a pandemic in the world was around 1918, 1919. And I think that's also significant, about 2 to 3 years. And if you look at us now, we are sort of into the third year. And luckily for us, we've got all the modern technology, to recognize the disease and to do something about it, which wasn't there in 1918. And I'm just saying this because, most countries would not have the capacity to, address a novel pandemic as we had. We had a few countries which had SARS, MERS, mainly in the East, South Korea and other countries. And if you remember, you'd see pictures of people with masks, ordinary people walking around with masks, which is where we are now. So all in all, while in saying that we were all learning, it was a trial and error, and I believe, however, that the mining industry was quite fortunate in having a few things in place which made sure that we mitigated the risk, and we recognized that we had a major crisis on our hands and therefore could put in place measures very quickly. So to sort of summarize what we did as the industry, we had very strong leadership from the CEO level. From the beginning of the pandemic, we had regular CEO meetings, and COVID-19 was top of the agenda at those meetings. We also put in place education of our employees. Long before the pandemic actually, or the epidemic reached South Africa, we started with education. Educational materials which were circulated to companies, and so employees could anticipate what was expected. We also had large-scale increases in testing capacity on our mines, and this really put the companies in good stead because they could then identify cases of COVID very quickly, isolate those people, and it limited the spread of the disease, among employees. We also had isolation and quarantine facilities, and as you are aware, some of our companies do have even hospital admission facilities, and with those isolation and quarantine infrastructure, with that, then all the sick employees could be monitored. They were monitored on a daily basis. Some were given thermometers, some were given oximeters, which of course in the epidemic were very crucial in terms of monitoring your decline and therefore needing to go into hospital. And there was also early referral to hospital, and that led to the lower mortality rate in the industry, which is at around 2%, lower than the national average. We also put in place a COVID-19 reporting system, which currently still monitors the screening for COVID, testing, the cases, the deaths, and later it was used for monitoring the vaccination that all the companies, were undertaking, and we could then report how many, people are vaccinated, as we heard this morning from the president. And again, vaccination was identified as a critical intervention to limit the impact of the disease. And we were one of the very very first sectors to advocate for access to vaccines. This ultimately ended up with a collaboration which was between government and business, led by B4SA through BUSA, and we were quite in the forefront of ensuring that vaccines were being rolled out. We had a special project set up at Minerals Council to support the companies to ensure that they were ready to provide vaccinations, and this was also extended to other sectors. So the mining industry is the leading economic sector and is currently far ahead of the national average for vaccinations. We have 3/4 of our employees, which is 75%, of the approximately 450,000 employees have had at least one dose of the vaccine, and 2/3, 66%, have been fully vaccinated, which we believe will assist in ensuring that our employees can ride out the next wave. And in fact, during the last wave, the Omicron wave, there definitely was very reduced levels of deaths in our employees. So we have had very close collaboration and cooperation with the Departments of Health, Mineral Resources and Energy, and Labor, and this enabled the industry to return employees safely to work and to vaccinate the majority of staff over the past 2 years. A further test for us now is the upsurge of cases in the country, and even in our industry, our companies are reporting that there are more cases, although a lot of them are not severe cases. But we will need to monitor this, because the last, in December, Omicron manifested as a far milder disease, but we cannot vouch that, the sub-variant we currently have will definitely be the same or even better, which therefore means that we need to still be vigilant, and especially for people who are unvaccinated and those who have comorbidities like diabetes, we have to make sure that they have adequate boosters and are covered for COVID-19. Vaccinations are the most important intervention that mining companies can make to address absenteeism caused by even mild cases of infection. So it's not just the severe disease and deaths, but even mild infections can lead to absenteeism, which is why we, as far as possible, try to address, the underlying causes, maintain all the non-pharmaceutical interventions to ensure that people do not contract the disease. The next step for us now is going to be integration of COVID-19 into existing programs. This is both health and other programs. We have had a new way of working, and all of those new ways of work need to be integrated into how we conduct work going forward. On the health part, we all know that there was a major impact on other health services, including in mining. There was poorer reporting for the normal, occupational diseases and other programs, and we need to now shift and get back to integrating COVID-19 into existing programs so that we can then not take away resources from other programs. In summary though, or sort of in concluding, the evolution of the virus and the higher protection that our employees have from vaccination and natural infection makes it possible for us to increase our efforts on integration, because we anticipate that future waves or upsurges in COVID-19 should have less impact on our employees. I will end by just indicating what the key stats are for our employees. As I said, we work on about 450,000 employees. It fluctuates a bit, but thus far we have got since the beginning of the epidemic, we've had 64,837 cases. We've had 749 deaths, which I can say is a very large number of employees, considering that under normal circumstances we would not have had that large number of people dying in the industry. And on vaccinations, I will just quote the total number of people that have at least had one dose, which is 339,389, which gives us the 75%. Thank you very much.
Is there anything you want to add?
Maybe, Alan, what I should add is the backdrop to this is the tremendous industry collaboration that has been going on to combat COVID. I mean, this was one of those instances where the industry really pulled together already from the beginning, where in early 2020 we were having challenges with obtaining PCR machines and getting tests, where the mining companies essentially went and sought RT-PCR testing equipment and inputs, putting them near the operations for community members and also for their own usage. And then, the collaboration also then moved on to providing facilities to be able to deal with patients. And, we collaborated in all provinces of the country, where there's mining, where there isn't mining. For instance, in the Eastern Cape, there was an initiative there to help out the hospitals essentially with oxygen-related products. As we know, even though there are no mines in the Eastern Cape, some of the workers come from there. And you can imagine that the mining companies had their own extensive initiatives to deal with the prevention and spread of COVID, but they also came together for these collaborations. In the Northern Cape, we had the Northern Cape Shared Value Project that we put on hold a little bit to say, hey, let's combat COVID. And the companies came together and amassed close to about 100 million rand that was provided to the Department of Health and the hospitals in the area to combat COVID. So there were these instances of the companies really pulling together to fight what was quite a novel case of a pandemic for the mining industry. So maybe that's what I just wanted to add. Thank you.